Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, some of the highlights. Today, coronavirus cases near 30,000 mark in Nigeria as country records 544 cases in 18 states plus the Federal Capital Territory and 11 deaths in 24 hours. Nigerian Medical Association NMA Cross River State withdraws medical services in the state due to what they term issues of COVID-19 testing, surveillance, contact tracing, isolation, treatment and care in the state. And India's COVID-19 cases surpassed Russia's after recording more than 24,000 new cases of COVID-19 in 24 hours. Africa has recorded over 461,000 confirmed COVID-19 cases on the continent, with more than 222,000 recoveries and 11,000 deaths. In Nigeria, the total confirmed cases has risen to 28,711 after the Nigeria Center for Disease Control (NCDC) announced 544 new cases in 18 states and the Federal Capital Territory last night. The total active cases stand at 16,401 and 11,665 patients have recovered, while the death toll is put at 645. Of the new infections, the highest number of cases were recorded in Lagos with 199, followed by Ebonyi, 65 cases. Oyo recorded 47, Ondo 46, Ogun 31, Edo 30, the FCT 28, Katsina 25, Plateau 15, Bayelsa 11, Kaduna and Adamawa 10 each, Akwa Ibom 8, Gombe 7, Kano 4, Taraba 3, 2 each in Rivers and Abia, and 1 case in Ekiti. A breakdown of the zones regionally show Lagos in the southwest remaining the epicenter of the pandemic with 11,244 cases, while states with the highest cases in other zones are the FCT, the North Central, Kano in the northwest. We have Edo State still leading in the south-south with 383. It's the third highest there, and then you have Kano. Also in the northeast, you have Borno returns to the top there at 528 cases, and Ebonyi leads in the southeast with 508 cases. The Federal Capital Territory, Abuja, is expanding its testing capacity by adding more facilities to test for COVID-19 in the territory. According to the NCDC, they include the National Reference Laboratory, Gadua, the University Teaching Hospital, Gwagwalada, the Federal Ministry of Health premises, the Garki General Hospital, the FMC Jabi, Yanya General Hospital, and National Hospital, Abuja. Till date, the state has tested a total of 17,915 COVID-19 samples. In the meantime, 19 COVID-19 patients have been discharged from the isolation centers in the FCT following their successful treatment, leaving the total number of cases discharged in the Federal Capital Territory to 508. The National Coordinator of the Presidential Task Force on COVID-19, Dr. Sani Aliyu, says the responsibility to supply personal protective equipment, PPEs, to state-owned health facilities rests on the state governments, and they need to step up with the provision and training of health workers on their usage. Dr. Aliyu made the remarks in Abuja while receiving donations of PPEs from Nigerians in diaspora through the chairman of the Nigerians in Diaspora Commission, NIDCOM, Mrs. Abike Dabiri Erewa. He insists that all federal healthcare facilities have enough PPEs for frontline health workers, just as the government has also trained 17,000 health workers on the proper use of the equipment.
Every state is going to get something. So as they've brought them packaged per state, so as you see those items, each state gets their own PPEs and they will be delivered directly Every state has an SA diaspora who will work with NCDC, PTF to get them to the appropriate destination. So for me, I think it's most commendable. It's heartwarming and touching that despite the challenge, they could put this together. And they still told us this is the first phase, that more will come. And as they do that, they'll be embarking on the second phase of awareness, mobilization, and saying that we all need to be careful.
Now, the World Health Organization has accepted the recommendation from the Solidarity Trials International Steering Committee to discontinue the trials hydroxychloroquine and lopinavir ritonavir arms. The Solidarity trial was established by WHO to find an effective COVID-19 treatment for hospitalized patients. The International Steering Committee formulated the recommendation in light of the evidence for hydroxychloroquine versus standard of care, from the Solidarity trial interim results and from a review of the evidence from all trials presented at the WHO Summit on COVID-19 Research and Innovation. Well, these interim trial results show that hydroxychloroquine and lopinavir produce little or no reaction in the mortality of hospitalized COVID-19 patients when compared to the standard of care. Well, Madagascar authorities have imposed a total lockdown on Analamanga region due to the rise in coronavirus cases. The region is in central Madagascar, containing the capital, Antananarivo, and its surrounding metropolitan area. The lockdown measures will be effective for a period of 15 days, starting Monday, July 6, to last until July 20. The decision is coming after an extraordinary Council of Ministers meeting who said the measures were taken because of the spread of the virus and the rise in cases. Let's go over to Kano State, where an epidemiologist has been speaking about the spread of the COVID-19 in the country. A member staff, the African Field Epidemiology Network, AfriNet, and part of the NCDC Rapid Response Team to Kano, Dr. Ababala, says that more testing is key to the pandemic fight.
Our sample collection techniques have also improved because initially we used to collect quite a few samples daily, but now we have started the community sampling, which has been ongoing for the past 1 week, and so far it has covered about 3 LGAs over a period of time when we were able to collect over 6,000 samples. And this can be seen from the turnout of results that we've been receiving. 2 days ago, out of about 1,400 plus samples, we got 41 positives. Yesterday, out of about 91 samples that were brought from the labs, we do not have a positive case. The response generally, it's now more smooth, and we hope, and there is a plan to scale up all the community sampling exercises in most of the high-risk LGAs.
The Nigerian Medical Association, NMA, Cross River State branch has given a notice of withdrawal of its medical services. According to the association, there are several issues in the state's COVID-19 testing, surveillance, contact tracing, isolation, treatment and care. The association demands explanation from the NCDC why 5 COVID-19 confirmed cases from UCTH carried out by the NCDC accredited molecular laboratory, Ebonyi State, have not reflected in the daily situation report of the NCDC long after results had been transmitted to the UCTH July the 1st. They're demanding the update of the NCDC situation report as a matter of urgent public interest. They've also put the NCDC on notice that the Cross River State government, according to them, have abdicated her responsibility of contact tracing, treatment and care for the 5 confirmed cases, which they're saying may not be unconnected with the delay in publication of results by the NCDC. The Benue State Action Committee on COVID-19 confirmed the death of the committee's vice chairman, Professor Godwin Achinge, from COVID-19 complications. A member of the Risk Communication Subcommittee, Mr. Bengba Ihotam, in a telephone conversation, says the casualty figure has risen to 6, with the death of Professor Achinge reflecting a change in the state's incident dashboard. Until his death, Professor Godwin Achinge was also the Deputy Vice-Chancellor in charge of administration at the Benue State University. Died on Sunday after he tested positive for COVID-19 early last week. In Imo State, the state's COVID-19 task force has been working with several agencies in the state, carrying out sensitization and awareness on COVID-19 safety protocols to curb the pandemic spread. Dr. Dunge Kingsley XL is a medical laboratory scientist researcher. He's the chairman Association of Medical Laboratory Scientists of Nigeria, Imo State branch, a member of the Imo State COVID-19 Task Force and chairman, the Enforcement Committee. He joins us via Skype from Imo. Thank you for joining us at this time.
Yeah, good afternoon.
All right, now Imo is recording more cases, pretty much like all the other states around the country. How much awareness would you say is ongoing, enlightening people about the dangers of COVID-19 and how to protect themselves?
Okay, the State Imo State COVID-19 team, heavily led by Professor Maurice Iwo, are at it every time, and in spite of what we have done, we have taken it as a point of view to make sure that we bring enforcement to every nook and cranny. On Sundays, we do visit churches, making sure that they adhere strictly to the protocols of worshiping in church, and of course, we go to places, shopping mall, no face masks, no entrance, across Owerri and this environment. So, for all that I can say, the COVID-19 Enforcement Subcommittee and the task force are doing their best to ensure that we prevent community spreading, as the case may be. And on the other hand, because of the enormous task that is involved due to this community spreading, we have upped our game. The governor of the state, His Excellency, Senator Hope Uzodinma, in collaboration with the chairman of the task force, instructed that we collaborate with the ministry agencies who have something to do with a different portfolio. For instance, we engaged the Ministry of Transport, which by mandate is to help ensure that the buses and small taxis in Owerri and Imo State adhere to the strict guidelines of carrying 50% capacity and also use of face masks, both by the driver and the passengers. On the other vein, we also engage the Ministry of Commerce and Industry, who is charged with the responsibility of going to the markets to enforce the procedures of hand wash at all times, notable hand wash stations in entering to the market, and also use of face mask and social distancing. Then again, we also engage the Ministry of Hospitality and Tourism. Their own charge is to ensure that the hotels adhere to the strict guidance and public safety too. So the enforcement and enlightenment is ongoing in Imo State. Even before I came to the studio, we went to the market at Amakoya to make sure we sensitize people and also share masks to them. But I want to also use the opportunity to reiterate that people shouldn't misconstrue the federal government. The issue is not on the protocols as the case may be, or as it were. It's only interstate travel that was given to restrictions that people can travel from one state to another. The other protocols of not gathering of more than 20 persons in the place, hand wash and the sanitizers and social distancing is also in place. So people shouldn't think that government has said you can do anything you like. So obeying of these guidelines and protocols is very, very important at this point in time to prevent community spreading.
Well, I'd like to thank you, Dr. Dunge Kingsley XL, Medical Laboratory Scientist, also Chairman Enforcement Committee. Thank you for joining us on the program.
Thank you very much.
Now, according to the NCDC, there is a strong need to strengthen messaging around the ease of lockdown as risky behaviours are pressing a challenge. This is confronting the messaging on COVID-19 and its dangers. Well, for more on the impact of the virus in people, we have Dr. Safia Ojo, a family physician. She joins us from Abuja studios. I'd like to thank you, Dr. Ojo, for joining us at this time.
You're welcome.
All right, let's start with what we're seeing. Looking at the weekend and where we are in terms of our numbers, over 28,000. So we're getting more cases in Nigeria. How would you say we're doing in terms of the enlightenment and also reducing the transmission spread?
Thank you very much. COVID-19, we know, is a novel virus, which is a new virus, a new strain of the coronavirus, which has resulted in a very large death toll in some parts of the world. And we know the common symptoms of coronavirus, which include cough, chest pain, difficulty in breathing. Some could have other symptoms like loss of smell and anosmia. And some could also come down with some GIT symptoms. Yes, the war against COVID-19 is not a small one. We need to keep strengthening our health system and make sure we keep enlightening the public about the dangers, how this virus is being contracted, so that they can actually avoid coming in contact with the virus. So a lot has been said, but we need to still keep talking, especially in the rural area and in remote areas where there are no access to televisions, radio, to listen to what is all about the virus, to know ways of preventing it and how to even present when there are symptoms, when to present to the hospital when there are symptoms of coronavirus. We know the impact of coronavirus is much. It has both physical impact on individuals and the nation at large, psychological impact and economic impact. We know how we are, most of our students now are at home because of COVID-19. Even a lot has happened because of COVID-19. Even economic impact it has really affected our economic impact. So I think we need to keep talking more about it, so a lot of people can get to know that there is existence of a particular virus and the risks of contracting it. Then one thing we need to also work on is we need to also, those that are high risk group, like the elderly people, those with diabetes, with chronic illnesses, diabetes, hypertension, heart diseases, asthmatic patients, all those conditions, they are prone to having severe forms of COVID-19. So we need to emphasize on that. We need to let them know that they must continue on their medication. Lifestyle, very important, like exercise, trying to eat a healthy diet, and try to avoid contact, limiting large crowds, and making sure that the social distancing is being adhered to, then washing of hands with water and soap, or the use of hand sanitizers. So I think a lot has to be done. We need to keep talking about it, and like more talking about it will help a lot of people to know about it. So
Dr. Ojo? Right, if I just quickly may, contact tracing is also a very important factor in this fight. And seeing that we're going to have travel opened July 8, talking about air travel, and then we have the interstate travel ban that has been lifted. How effective would you say our contact tracing is? We have several countries who have contact tracing apps that seem to be working. But, you know, for us, and especially in tracing and tracking the carriers of the virus, how effective would you say our contact tracing efforts are?
Well, contact tracing is very important. If you need to to limit the number of people coming down with COVID-19, doing contact tracing, yes, we need to know. People has to be screened to even know if they have the virus or not. And you need to also know who they have come in contact with, their family members, where they have gone to after that, so that a lot of people can be tested to know if they have contracted this COVID-19 or not. So the role of contact tracing cannot be overemphasized. It's very important. It's mandatory. So that's why, like in the case of Cross River now, they're talking about this is something we need to really work on. The contact tracing is very important. And those that are even tested, let more people be tested, so that let there be facility to even test, to know who is positive, and how do we even do contact tracing to know how to combat this, to reduce the incidence of new cases of COVID-19. Even talking about the flights, yes, we need to, life has to move on even if there is COVID-19, but a lot of measures has to be put in place. For example, the social distance, even when you want to board a plane, you need to, like, the social distancing measures has to be put in place. Hand washing and all that, temperature checks, appropriate check of the luggages and all that will also help to limit spread of COVID-19. So it's very important, it's paramount for us to do contact tracing so as to reduce the risks of those coming down even with severe forms of the disease.
We'd like to appreciate your time. Dr. Safia Ojo, family physician, thank you for joining us on the program.
You're welcome.
India now has the third largest number of confirmed cases in the world, overtaking Russia with over 600,000 infections and more than 19,000 deaths. The latest surge in numbers has been powered by a rise in cases from a handful of southern states. According to the World Health Organization, the global number of confirmed COVID-19 cases has reached over 10 million, and the disease has claimed more than 523,000 lives.
With more than 24,000 new cases of COVID-19 in the past 24 hours, India has overtaken Russia in its total number of confirmed cases. This makes the country the world's third highest at 697,413. There have been 19,693 deaths. About a month ago, India reopened its shopping centres, places of worship and offices. The border between Australia's two most populous states will close from July 7th for an indefinite period following an outbreak of the coronavirus in Victoria State. The decision marks the first time the border with neighbouring New South Wales has been shut in 100 years. It appears history is repeating itself, as the last time the borders were blocked was during the 1918 Spanish flu pandemic.
So today and tomorrow is the last time in which any Victorians will be allowed across the border unless they have a special permit or some exemption. We have done this based on health advice.
Latin America has reported more than 2.9 million COVID-19 cases, with Brazil topping 1.6 million confirmed cases in the region. The Brazilian Health Ministry raised the national count of COVID-19 cases to 1,603,055 cases, with a death toll of 64,867. And with no paparazzis or parties, Paris prepares for a virtual fashion week. The city, which is usually a buzz during its prestigious haute couture presentations in July, with hotels normally heaving with fashionistas and landmarks turned into catwalk venues, it's a different story this year. In a makeover triggered by the coronavirus crisis, top designers will now be experimenting with online showcases to try and keep their clients hooked.
The new normal. Well, from the NCDC, most COVID-19 cases are in people aged 20 to 40, while most deaths are in those over 50. No age group should be blamed, as COVID-19 affects our lives in different ways. We must take precautions to protect our older relatives and everyone. You can find regular updates on the COVID-19, of course, the NCDC website on the COVID-19 regulations and also guidelines. There's several information statistics depending on where you are. From the World Health Organization website, your questions are answered on the coronavirus disease situation with the latest global numbers by country of COVID-19 cases on a daily basis. You can take a closer look at some of the information there on other outbreaks as well on their website. And channelstv.com, the website at your fingertips, has the latest news. You can see there top stories in politics, health, of course on the pandemic. You can find news from Africa and around the world, channelstv.com. That's a COVID-19 update. Thank you for watching. I'm Millicent Walker.